Hello, I'm Cathy Creswell. I'm a Professor of Clinical Developmental Psychology at the University of Oxford and the lead for the Emerging Minds Network. And I'm just going to say a bit about what the network's about and some of our current opportunities. The Emerging Minds Network is really about creating a research community focused on reducing the prevalence of mental ill health amongst children and young people. And our aim is to bring people together who work across academic disciplines, but also across sectors, and with stakeholders, including children and families and others who have relevant experience, to really address some of the key challenges in relation to mental health in children and young people. So our leadership team bring a really broad range of experience and expertise. They include academic partners from a number of different universities across the country who have expertise in a broad range of disciplines, including medicine, psychology, art and design, information technology, computer science, media studies, sociology, medical history, and so on. We also have on our leadership team some key partnerships with third sector partners, particularly the NSPCC, Young Minds and the Centre for Mental Health, who've worked closely with us all the way through the network. We're also working very closely with the Mental Health, who are helping us with dissemination, as well as MQ, and are doing a particular project with the Mental Health Museum. What we're trying to all do is to foster research collaborations, and we're organising all the work that we're doing around four main research challenges that have been developed in partnership with young people, their families, practitioners and policymakers. And that work was all done working with Young Minds and the Centre for Mental Health. So the first question that we're focusing on, we've called the big question, and it's really all about implementing effective promotion of good mental health and prevention and treatment of mental health problems at scale. We know there are loads of really great initiatives going on, but often it feels like the solutions are being reinvented all over the place for every different potential context and location. And actually we can learn a lot from each other by understanding how we scale things up, what things do need to stay the same, and what things need to be adapted in particular situations. And there are a number of ways we can address this big question about how we implement effective mental health interventions at scale. One is, of course, taking what we know about what protects children and young people from mental health problems, but also what creates risks and maintenance factors that drive mental health problems, and using that information to implement effective promotion, prevention or treatment. But also it's possible to take examples of what we already know, that we already have evidence for, so models and interventions, and conduct the research to help us understand how we can deliver those at scale in ways that continue to be accessible and critically continue to be effective. The second research question that came out of our consultation is called Embracing Complexity, and this is really about how we can best meet the needs of children and young people who have intersecting needs or face complex situations to promote good mental health among that group, and also to prevent and treat mental health problems. This is something that came up a lot in our consultation, and particular groups that were highlighted, including children who are outside of mainstream school or who are at risk of school exclusion, children with special educational needs, communication challenges, physical health conditions, comorbid and complex conditions, and behavioural difficulties. And it was really emphasised in our consultation that this research needs to keep an emphasis on impact at scale, but taking firmly into account the intersecting needs that children and young people might have, making sure that those children and young people, particularly those maybe who are not in mainstream school, still have access to mental health promotion. And there was a lot of discussion about how multi-agency systems, commissioners and so on, could operate and cooperate to support children and young people in these contexts. The next research question that we've focused on is called Voices, Power and Attitudes. And again, this is a bit of a two-part question. So first of all, how can young people's voices and power be amplified and heard in ways that have a positive impact on their own and other people's mental health and well-being? And secondly, how can societal values and attitudes and behaviours be changed in ways that have a positive impact on children and young people's mental health and well-being? And so particular considerations that came out of the consultation included how we can best support children and young people from marginalised groups, how voices and power can be used and amplified in the design and delivery of interventions, services and individual treatments, as well as other contexts such as education, and what the impacts of that are for the acceptability and effectiveness of those interventions. And also consideration of factors such as decision making, representation and agency, including consideration of social media amongst all of that. And then the second part of the question, talking about societal values, attitudes and behaviours, it was highlighted that this may reflect changes in societal attitudes relating to mental health in its own right, but also in areas that may impact on mental health. So, for example, prejudice and stigma that people might experience for other reasons. And it was really highlighted in the consultation that we need to be considering what we can learn from other contexts. So, for example, taking a historical perspective, what can we learn about how to bring about major shifts in societal attitudes? And what can we learn from what's known elsewhere about the effect of, for example, media portrayals? What can we learn about the impact of, for example, well-known people sharing their experience? Does this have a normalising effect, or are there other unforeseen, unexpected effects? Finally, the fourth question that we're focusing on from the consultation is called supporting the supporters. And this is really about how we can help young people themselves and people who are often around young people to help in terms of benefits for mental health for children and young people. So that might be about how can young people be better enabled to help each other, promote good mental health, prevent, potentially overcome emerging mental health difficulties, and how can family members be supported to help achieve those outcomes. And then finally, how can settings and activities where young people spend their time and where they interact with adults, how can people working in those settings support the good mental health of children and young people? So that might be in sports clubs, in primary care, in schools, and a range of other settings. And here in our consultation, consideration was really encouraged of thinking about how we can ensure that young people, approaches with young people are attractive to a variety of young people, and so don't bring about exclusion of particular groups. It was researchers and collaborators were encouraged to think about what's appropriate to expect of peers in terms of what's reasonable for them to do for each other, what are the limits of this type of activity, and how benefits can be gained from the influence of factors such as friendship, identity and community. When it comes to family members, again, people wondered what's it appropriate to expect of family members? What are the limits or potential risks of supporting families? And when and how might effective interventions best occur when working through families? Across all of the research challenges that we're focusing on, a number of cross-cutting areas were highlighted. The main one is that all of the research that we're supporting should be focusing on impact and really trying to make a difference to children and young people's mental health. And in order to make that happen, it was really stressed that the research needs to have meaningful involvement and consideration of those with lived experience and other stakeholders, and also needs to make sure that the people who are in a position to implement the research, whether that's policymakers, commissioners or practitioners, making sure those people are also involved and can see and are ready to take forward the benefits from the research. And also to make sure this research makes a difference, it will be critical that the researchers are prepared to communicate their findings and good practice in accessible ways, and that we as a network support that. And finally, because obviously we're always working with limited resources, it's really important that people think about how they can really make the most of existing data and research. So we want people obviously to be building on what's already known, and where there is existing data that can be used to ask important questions, we'd like to encourage that to happen.